100,000 cases and 50,000 deaths internationally. So we're in a very good position here in Australia. I think I also want to talk today about the fact there is no hotspots in Australia, at least from the Commonwealth perspective, and indeed by any way of looking at hotspots, there just aren't any. So we're in a good position. We are still, of course, continuing to see cases in hotel quarantine, and that relates to the overseas situation. As long as we're having Australians and others coming home, Australians coming home and others coming into the country, we will be seeing people in hotel quarantine with COVID-19. I just want to talk also about the vaccine. There's been quite a lot of reports about the unfortunate events that have been happening in Norway and also, in fact, in Germany in relation to the Pfizer vaccine and its use in the very frail, very old members of the population, particularly in aged care facilities in those countries. We're in direct conversation, and certainly the TGA, Professor John Skerritt, is in direct conversation with his counterparts in Norway and in the European Medicines Authority about these matters. We know that Norway is looking into those issues very directly and very specifically for each of those cases. At the moment, they do point out, and this is publicly available information as well, that in Norway, in a normal week, 400 people do pass away in their aged care facilities. And so that has to be put in the context of what's happened after people have received vaccines. And that needs to be looked at very carefully, and the TGA will, of course, take that information into account in their assessment in the coming days and weeks. This is exactly, of course, the reason why, because of the good situation we're in Australia from the epidemiology of the disease, we can actually wait and have waited to do a full assessment, not only of the clinical trial information, but also the information that's coming from those other countries that are rolling out the Pfizer vaccine, the AstraZeneca vaccine, the Moderna vaccine and others. So that will be taken into account. At this stage, it won't delay that process, but the TGA is doing its due diligence, as we expect them to do as the independent regulator of these matters. So we have a balanced portfolio of vaccines that we're working through. Pfizer will most likely be the first to get approval, but that's subject to the TGA's very detailed look at that vaccine and their assessment. We have the AstraZeneca vaccine as well, which, as we know, we're certainly not alone in the world for pre-ordering that particular vaccine. 100 million in the UK, 200 million in China, 300 million in the US, 400 million in the EU, and 500 million in India. So there are literally over 1 billion doses have been pre-ordered around the world of the AstraZeneca vaccine, and that's very actively being considered both by our expert advisory group, ATAGI, as well as the way that that's playing into the TGA assessment in relation to that vaccine. So we have that balanced portfolio, and they're on track for the starting vaccination in Australia next month, subject, of course, to the TGA approval and to the supply of those products into Australia. I just wanted to make one other point about vaccines, and that's the concept of vaccine effectiveness. Vaccination effectiveness is more than just the efficacy of the vaccines. That might just sound like words, but it's a very important concept. So there was some debate last week about whether the AstraZeneca vaccine was somehow had less effectiveness than the Pfizer vaccine. That's related to the phase 3 clinical trials. We talked about that last week. But the efficacy of the vaccine is only one component. There are 3 components to effectiveness for vaccination programs. One of them is the efficacy of the vaccine. There's also the duration of effect of the vaccine, and my esteemed colleague Alan Cheng made some comments on that in the Australian newspaper today. We don't know how long these vaccines are effective for because they're so new. So whether we need to do a booster at some point remains to be seen. So efficacy, the duration of effect, and the third one is the coverage. We need to give as many vaccines out into the community as possible, and if we don't do that, then the effectiveness will be indeed affected.